my first question is for Howard and Corrine. So childcare access and affordability is a concern for a lot of families in the district. First, Howard, what have you done to address this problem? And second, Corrine, how would you address this challenge?
Okay, yes, thank you everybody. Thanks for having me here today. Question about childcare. Does anyone in the room have children? Raise your hand. Because if they're cute and they want to come take their picture with me later, that would be great. I do love having that picture taken with children. I will say about childcare, I have willfully ignored all efforts to fund childcare because, you know, I'm a little stingy and whatnot. But, you know, in this last budget, I finally had to give in because I know that I'm now in a district that is somewhat competitive, and so I have to listen at least a little bit. Yeah, so we gave in just a little bit. We gave some crumbs, as you would say, and that's what I think we deserve for our children, is the crumbs. So that's my answer. Thank you.
Give me a moment. All right. Well, this is nothing that I actually haven't said to Senator Markline in person, so I am happy to have this conversation with you, Senator. It took 5 years for you to agree to meet with the Greene County Child Care Network. We met with all of the other 6 representatives in Greene County over the years, and you finally agreed to meet with us this summer. We showed you our books. We showed you how little we make. You continue to say that parents should be able to will pay in order to make sure their children are in a safe place. And to that, I say that is absurd and out of touch, because it is not fair to assume that people making $7.50 to $10 an hour can afford childcare. And because your accounting is terrible as far as subsidy goes, you don't ever account for the actual dollars that it costs for childcare, and the way our state does it is still old, and I have talked to you and tried to get you to change that as well. Furthermore, I'd like to bring up the propaganda I got October 1st. I closed my family childcare August 29th. I emailed and asked him to come visit me and talk to me about why I had closed, and it was because of the budget. Yes, $360 million was allocated. Of that, all but $60 million was federal dollars that would have been allocated anyhow. Every time, it's always federal dollars. There's $60 million that actually takes from the public schools, moves it into childcare, because those 4-year-olds, instead of going to the public school, will be able to stay in the childcare, and that money will go to them. It doesn't get pulled out, but the kids aren't included in the school. And we had pushed for, at state level with childcare, for a bill that would build bridges and collaboration between schools and childcares to make sure that kids were taken care of and had appropriate public education, no matter which location, without hurting the schools. And this hurts the schools, and it does not help most of the childcares. But you sent me this thanking me for my service and how great it was that I had this childcare. And I want to remind you, I was closed.
Well, thank you for your service.
You're welcome.
All right, second question is for Howard and Lisa. Affordable health care is a very topical issue right now, and creating a better system has vexed both parties. Howard, what have you done with respect to healthcare costs in the district? And Lisa, what would you do?
Okay, yes, healthcare. Okay, and what have I done? Well, here's the thing about healthcare. We have to pay a lot for healthcare. We've paid a lot in taxes and federal taxes for Obamacare, as they call it. And, well, here's the thing. Most other states have agreed to have that money come back to them to expand Medicaid. And we here in Wisconsin have blocked that expansion, so that therefore the money that you already paid in your taxes won't come back to you and won't help you out. Because we're so set in our ways and set in our principles that we don't want your own tax money to come back and help you out. So that's what I think is the answer for healthcare, is just be stingy. That's the answer.
Hi, Howard, Senator Markline. I'd like to say just a little bit, I do respect people's reactions to comedy, but I want to thank Matt Raboyne and Jimmy Kimmel and all the people who help us laugh and see the light and protect our freedom of speech. Yeah. With regard to Kermit, Howard, I'm sorry, I was thinking of someone else. Howard, healthcare. Do you realize that I'm a former mental health nurse? We should have a talk. Anyway.
About what?
We'll talk. I'll get your business card. Here's the deal, Howard. I'm going to let you off the hook because our healthcare system it's not just Wisconsin, it's just not you. You're just used to falling in line. I feel like our entire healthcare system, I'm a construction remodeler, did I tell you that? We can't do touch-ups anymore. We have to do a full reblown remodel on our healthcare. And you're not alone, it's the whole United States. What we need to do, and we can use AI, the new enemy, and the new shiny toy, to integrate patient-client information services. We can pull together social services, mental health, all kinds of specialties. I have elderly parents, and good thing I have a medical background because they've got a specialist over here for this and a GP over here for that, and then my mom's eye clinic in Iowa City. And what we really need to do is refashion the entire model of how we fund healthcare. Vermont has something called an ACO, and I have to look it up because I'm not good with acronyms. Accountable Care Organizers. What they basically do is create medical houses where all of the information of all the caregivers are integrated, where they use both Medicaid, Medicare, and private insurances to reimburse this. What they've done is clinicians, insurers, and all of the framework of healthcare, including EMT, have come together to integrate their systems. One of the things, an example, Howard or Kermit or whoever you are. Anyway, have you ever stopped to think when you have a kid with an ear infection and you don't have health insurance, what do people do? They go to the emergency room, right? What could be a $70 office call on an antibiotic turns into a $2,000 charge, and they can't ever get out from under it, and we pick it up, right? If we had integrated healthcare and we had a triage specialist, a nurse or a health specialist who could either intercept a phone call or an online presence, could triage to someone and send them to a walk-in care, which I think should be universally funded. Because if you can have a choice, you don't let people get so sick. You don't let them show up at an emergency room with exorbitant bills. You take care of the problem where it is. And integrated, or ACO, forms of modeling, we can actually even take mobile units out to rural areas to run blood tests, x-rays, therapy appointments. If you can't bring rural people into these big buildings with all this high-tech equipment, we can go out to them. How's that, Howard? We good?
I wasn't listening. What?
I know.
We have one more question each. So Corrine, this is for you and Howard. Public schools are at the heart of a lot of the small communities in the district. With current caps on state funds, schools around the state have been relying on local referendums to fund them. And we're seeing an increasing gap in funding between schools in poor districts and schools in wealthier districts. What role do you think the state should play to ensure quality education for all students? We'll let Howard go first, I guess.
Okay. Well, I have made historic investments in our schools. I can't back that up, but I do like to say that. Let's see. The school here. I had something to say here. Okay, well, here's what I think the answer is. I've been supporting school vouchers, and I think that's a great thing. Our public schools, it's probably better to just siphon some of that money out and into more private schools. So I've been a big supporter of the voucher program, and I'm really proud of the budget surplus we have right now, and the fact that we've saved so much money by not raising our expenses to go along with inflation with our schools. Because teachers, they just need to learn how to get by with less and do more.
Does sum up here. It does sum up the last three budgets. So I actually was on my school board from 2020 to 2023 and had the honor of serving with Bill Omakin back there. And we passed an operational referendum during that time because our schools needed more funding so that we could keep the quality teachers that we had, and we could ensure that our kids with special needs were able to get the minimum services they required and attempt to get them what they actually needed. And so first off, fair taxation. That's how we pay for it. The Wisconsin Manufacturers Commerce and Ag right now, they actually pay 0.5% in their income taxes for their profits, because they get that much of a reduction in their taxes. And that happened right when they stopped funding schools. So literally that money is why we don't have the money in our schools. Secondly, get rid of those vouchers. And I don't know how many of you know this, but the voucher cap actually ends this summer. So right now you can have X amount of students on vouchers across the state, and that ends in June. If a bill that has been introduced by Christian Phelps in the Assembly does not get passed, you're looking at even more money will be pulled out of our schools. $1 billion a year is pulled out of our schools right now to go to private schools who do not have to follow the same rules. Those teachers do not have to have licenses or background checks necessarily. And so the DPI, the Capital Times, big investigation they had, we don't even know how many are happening at private schools because people can go there and there's nothing DPI can do because they don't have a license. I have a family actually that DPI talked about at the hearing. I know them personally, and I've been working with her and talking with her, and it's terrifying what has happened to her family, and there's nothing that the state can do because their hands are tied. So we need to look at what our rules are. We need to say if we're going to have this two-tier system, which I prefer we get rid of and think we should, then you need to have the same tests, the same teaching requirements, and the same transparency and the same report cards that we do for public schools, because public schools and public dollars. How can you say these private schools are better when you literally have no data that shows it, except you think it is because you spend more money on it? Also, our voucher schools got 170 more per student than our public schools got 0. You may have just gotten the Mark Line update this last Friday that talked about how your enrollment went down. Yeah, that's because the birth rate has declined significantly. Last year, my son, he graduated with the biggest graduating class across the country. Whatever reason, we all had children that year. I don't know why. But they left, and so the kids coming in are the COVID kids. So every district literally did lose students because the number of children that were seniors and the number going in were that much different. It's not because the schools are bad. It's not because people are choosing to keep their kids homeschooled or private schools. Our young people are leaving the state and they're not having kids because they can't afford it, not because they don't want to. So we need to really look at how we're funding our public schools, make them whole, and also look at our communities and making sure it's affordable.
And finally, the majority of this district is comprised of small towns, farms, and rural communities. The majority of jobs in the district are in small businesses. First, Howard, what have you done to support the prosperity of our rural communities? And second, Lisa, what would you do to support the prosperity of our rural communities as well?
Do I need to do any of the education, or do we each have our?
You each get your own.
What's that? Oh, okay, we'll let Howard talk first.
Okay, so the economic growth question, or the prosperity. What I believe, what I've always believed, is that the path to prosperity is tax cuts for the wealthy. Especially because they tend to be great donors for me. So I've done some great things. Our signature legislation that we had a few years ago that was really a huge, amazing project was this Foxconn program, and it was going to bring lots of. Granted, it was a race to the bottom for environmental standards, and we were just kind of prostituting our state out to the lowest bidder. And granted, it didn't even work out in the end. But I was willing to put out billions of dollars for that program. And granted, it wasn't even in our district, but I did vote to support that. That's kind of my vision. Help out the wealthy.
Okay, here we go again. I wanted to speak to, and this ties in, the two questions do indeed tie in together. If you don't have a public school, you don't have a community, right? It really just crushes your existence as a community. And that also feeds into small businesses, free enterprise, agriculture. It's all tied together. Economically, we can't amputate parts of it, and we have to address it all together, right? When we see the underfunding of our schools, that's just what it is. And I've been doing a deep dive on that model of funding too. We have, in Wisconsin, created an adversarial role between property owners who bear the absolute brunt through paying property taxes for the funding of our public education. Now talk about division. If you want to really create division, set up an adversarial role. Our Wisconsin schools are underfunded, period. We need to have that put into the budget. The state of Massachusetts a number of years ago, probably 20, 25 years ago, were in a state of collapse. And they really stepped up and they created a funding model that did not tie property ownership directly to education. They funded it through the state budget. And I want to carry that model over because I think, you know, being in the trades, you can't keep putting layers of new shingles over old sheeting. Sometimes you have to tear it off and redo what you do. You can't just keep patching this problem. You getting this, Howard? You awake over there?
Oh, sorry. No.
Okay.
What?
So Howard, what I want to do, I propose is that we get creative and give up the cheese plates in the dairy breakfast food line and really go deep and figure out how do we fund our schools. We are so underfunded, and especially with regards to special needs kids and autistic kids. Do you know what that is, Howard? We need to weight our funding for those kids who need that extra help, right? Also, I propose a penny for kids, for Wisconsin's kids. We have a lower income tax rate than Iowa and some neighboring states. 1 cent per year, Howard, I know, it's okay. You'll be all right. 1 cent per year is literally hundreds of millions coming through income tax. And it's more equitable. It's people coming into our state because we're a tourism state, right? We've got Green Bay Packer fans, tourists. That 1 penny, we're talking like $600 million. And then, Howard, I want to loosen up that damned surplus and get our schools funded. Thank you.
Okay, thanks for having me, guys.
Another round of applause for Howard.